Morning, everyone. I looked at my calendar and realized, oh my word, it is a Friday the 13th. And that was kind of scary. It is Friday the 13th, August the 13th. Just what we need. Um, anyway, a few of y'all actually noticed that I skipped the video last week. Thank you for noticing. And I really had a hard time struggling preparing for this video this week. Honestly, it's COVID fatigue. Uh, I know y'all know what I'm talking about. I'm tired, I'm frustrated, and I'm even some anger in there. I'm tired of this virus. We've been fighting this war since for 17 months. I'm frustrated because there's so many people being sick and we can't get the vaccination message out there. And now I watch a lot of friends um, have COVID. So unnecessary in so many cases. So yeah, I was having a real struggle. So I asked my executive management team. Let me turn my noisemaker over here off some. I asked my executive management team to give me some thoughts and some ideas. So almost everything that I'm going to bring y'all up to date on were their ideas. It really is true. I remember Dr. Roosevelt Daniel used to say this all the time. Teamwork makes the dream work. And that really, truly is the case. So thank you, executive management team. So before I cover all things COVID, and I can't have a video with talking about all things COVID, I am going to talk about things not COVID first off. Um, and one of the first things I want to talk about is this vision that we have set for ourselves since the first of the year. And that vision has been to assure that every employee at CareSouth has a living wage and that we accommodate in parity adjustments for that. And we've been doing that. Over 50% of our departments and staff now, we have addressed having the minimum living wage, which is right at $15 in our communities, and making the parity adjustments for those that are above that to make sure that we adjust and make equal increases. Now, folks, we can't afford to do this all at one time, so it is right now just 50%. But we have made a commitment, and our board of directors has supported this, that this be rolled out. And if the Lord willing and the creek don't rise, we're hoping to be able to finish rollout by the end of the year. Now, don't be emailing Denise, please, with when am I going to get my raise and all of that. We have a plan and we are working on that because now more than ever, we value every single one of you and we need and want to do the right thing. So, the living wage and the parity adjustments, it's happening. It really is happening. There was an Inclusion Council video that Shanika Pygott released, I think it was yesterday. And please take a minute or two to look at that video. It is so good. The Inclusion Council has been working on this and they compiled this video to really talk about what the definitions of equity, inclusion, all mean. Several of the different definitions. Folks have called it DEI, diversity, equity, and inclusion. And since then, in a more broadened approach, to look at inclusion as addressing justice, equity, inclusion, and diversity. As a matter of fact, I'm calling Shanika Pyatt our Chief Jedi for that reason. She leads the Inclusion Council, and the work that they are doing is really so valuable in this. So take a minute or two to look at that. She released it as part of Health Center Week, and it has indeed been a week of celebration, lots of excitement, and kudos out to the marketing and PR team over there with Amanda and Andrew Boardwine, Missy Johnson, and Joe Biddle and Marek, all doing a spectacular job of each day addressing a different key point, all the way from our agricultural farm workers, our legislators, ourselves, our staff, our patients, of course, and our board members. It's been quite a week. We've done quite a bit, and we can't say enough about how appreciative we are for you, the staff. You are what makes it really work. You are what makes Care South strong. So, Community Health Center Week has given us a little bit of a break, and it's been a fun week. A couple other announcements, though. We do have a couple of new nurse practitioners that are joining us. We have a new nurse practitioner for our value based care team. That new division has as chief of that division Dr. Janiqua Duncan. And joining us on that is going to be Makisha Shaw, a new nurse practitioner. She's going to be doing a lot of things that will contribute to value based care. Things like Medicare wellness visits, things like working in conjunction with the population health management staff to reduce cost and improve quality and case management amongst our clients. So we really welcome Makisha. We also welcome Stacy Cassidy in our telehealth efforts. Telehealth is really growing. We have rolled out telehealth now in Dillon County schools, and soon we will be finished rolling it out in all of Chesterfield County schools. This is going to be really important. You know, there's a lot of folks that are worried about this school year and what it's going to mean, and being able to have telehealth access for these students and dedicated telehealth access, that we're not just going to have to ask our existing providers, can we add more work to, what we will be able to do, and what Stacy Cassidy will be able to do is grant specific telehealth access. So we're very, very, very excited about that. Um, we also have some things going on with a grant that we received, and we call it the hypertension grant. It's a grant that was a collaboration between HRSA and the American Heart Association to really address achieving blood pressure control in very rural areas by using home monitoring devices, devices that patients can have at home and be linked to our electronic health record, ECW, so that we can know on a more regular and specific basis how well the hypertension is being controlled. And that's beginning to get rolled out. We are going to be able to start sharing those devices, identifying patients, and really helping address hypertension control, which you should know is a serious, serious chronic disease issue in our particular area. The PD area is known by many as the stroke belt, and for a lot of reason, we have some of the poorest outcomes in achieving hypertension control. So we're anxious to see the development of this new tool, home monitoring, and the impact that that can make. I'm looking at notes to make sure that I don't miss anything before I do turn to all things COVID. Um, I don't see anything that I think I'm missing, but we'll see. So let's go ahead and talk about all things COVID. Folks, it's no secret if you've been paying attention to the news or watching the DHEC numbers. The cases now are at a level as high as all the way back in January. And remember, January was a pretty high surge. It wasn't the highest surge that we had had, but it was a pretty high surge. And unfortunately, the case numbers are still going up. So many other states, their surge has been the highest ever. So we certainly don't want to be at that point. But there's a lot of fears and a lot of concerns that are being raised, particularly since the total vaccination rate in South Carolina is still amongst the poorest in the nation. So we are concerned. In that same vein, rapid testing and testing period at CareSouth has increased. We went in a 2-week period from having 204 tests to having 736 tests. And this was just ending back on July 30th. We're still compiling numbers for the week ending this week, and it may be even higher. And that is being experienced all across the state. I was on a call yesterday with the Department of Health who said every hospital, every testing location across the state and across the PD are having this same experience because people are worried. People are having some symptoms, and people are getting the message that the symptoms are Delta, are not necessarily like the symptoms of the original COVID that we all were experiencing back in 2020, where we knew, oh, sure, we had a lot of cough, we had shortness of breath, we had fever. We better get ourselves in for testing. And that's not the case with this Delta. It's coming across as sinus infections, colds, and it's turning out that people are testing positive. And that is really also having an impact on our monoclonal antibody infusions, which have just skyrocketed, going through the roof. We have had as many as 50 daily. Think about that. 50 people in that Sweet Bee area of Hartsville getting an infusion that lasts for an hour, and then they have to sit there. We have to keep our eyes on them to make sure that they don't have a reaction. That's a lot. That's a pretty big demand. And it's not just us. On the same call yesterday, hospitals across the state were saying they have seen the same thing. It is skyrocketing. The message has gotten out that the monoclonal antibody infusion really does help, and that's good news. We didn't have that back in December and in 2020. So that's good news that the word has gotten out, but the word has gotten out at the same time that Delta has hit us and the case rates are going up. So we're struggling. We are doing everything in our power, and I got to say that team over there is doing an incredible Herculean job in addressing this under some pretty tough circumstances. Uh, there's been a lot of back to school events that we've been doing, back to school bashes, and we've been able to offer the Pfizer vaccine to kids 12 and older, and there have been a few that have taken us up on that. That's good news. Every kid vaccinated means that they will have less likely a chance to spread it to their family, to their relatives, and to their other playmates and those classmates of theirs. So that's a good thing. But school is returning, and the vaccination rate amongst kids still remains low. So that is very concerning. Everybody needs to be on their P's and Q's for that. One of the elephants in the room lately has been a lot of discussion about boosters, boosters, boosters. When are boosters, or when can we get the third shot? And you may have heard the news that the FDA did announce yesterday that they were going to be making a recommendation around which the CDC would be meeting today, Friday the 13th, to decide whether or not the booster could be appropriate for what they call folks with weakened immune system, the immunocompromised folks. And these are people with cancer that are getting medication, drugs, infusions that can weaken the immune system, HIV patients, a lot of different people fall into this category. So we're going to be anxiously awaiting the CDC authority to go ahead and begin administering that third dose where appropriate. And yes, CARE South Carolina will be willing to accept the CDC guidelines and administer that third dose. We've got a few technicalities to work out, like what will be our criteria for this review. Will we need their provider's order for this? But um, again, on the call yesterday, DHEC had asked for those organizations that were going to be willing to step up to administer this booster when it becomes available for the immunocompromised. And we have to be willing to step up for this. There's so many other organizations that have frankly stopped vaccination. Our vaccination rate has diminished quite significantly, and we are going to scramble to figure out how we're going to accommodate these booster doses. But we will do everything in our power to get it done and to get this important booster out to those that will need it the most. And we'll stay tuned for any further developments, which I'll keep you abreast of. So there is a lot going on. OSHA even released some new guidelines that are making us stop and think about whether or not we need to go back and re-implement some things that we have been doing a while back, like screening. We already re-implemented masking, so that recommendation of OSHA we don't have to come back around with, but we're going to be looking at these things also. We're going to be looking carefully at our work sites. Are we protecting you, the staff, in having your work sites as safe? I know we put up barriers, those plastic barriers in many locations. So this has come back on the radar screen again, and OSHA has now made it formal. We have to look at using the N95 and fit testing them, not just using them, but figuring out how we can fit test them. So, folks, the bottom line is the virus is not gone. If anything, it has a resurgence. And this resurgence may be one of the most difficult battles we've confronted since the beginning. You know, as I go back and I think about it, how it was in the beginning, and we fought this initial battle, but we were vigorous. We knew we could be CARE South Carolina strong. We knew we were going to take it head on. And now we're tired. Now we're fatigued. Now we're frustrated. We're stressed. We're dragging. So this is a really, really tough time to be faced with some of this that is worse than it was even in the beginning. But remember, we have tools in our toolkits that we didn't have back in June and July of last year. We didn't have vaccinations. We didn't have the monoclonal antibody treatments. We didn't have a lot of supplies back then. Remember all those short supplies that we had? Now we are getting a short supply of rapid test kits. But remember all of that. So as we think about our frustrations, our disappointments even, our questions, our anger, it's natural. Turn to each other. And don't forget, we have a whole mental health department. In my specific case, we've had a coach that has worked with us for years. I turn to him and express this. So get help. It is up to us, each individually, to make sure that we are CARE South Carolina strong as we can be. It's a road that is not easy. I know that. I'm on the same road with you. Let's stay strong. Let's do everything in our power that we can. And we will. Y'all have a happy August the 13th, Friday the 13th. It's going to be hot. We are expecting a tropical storm to come through next week, so we'll get a little rain and a break maybe in the temperatures. But most of all, stay safe, stay healthy. We're all in this together. Bye bye.